than our local cable subscribers.
All right, I'm going to make a motion to start the Board of Health meeting at 5:30 on May 13th.
I'll second that motion. All in favor, Beth, yes?
Steve, yes.
All right, welcome everyone. Before we get started, I'm going to read some opening remarks. In accordance with, hold on one second. In accordance with Mass General Law, we are required to let you know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time, 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a question or a topic for later discussion via email to the health@easthamptonma.gov email. And the first thing on the agenda is public speak time, and I just want to, before we start that, just mention that there will be opportunity to have public comments during the hearings, agenda items 3 and 4 regarding the tobacco regulations and the variance denial appeal. So with that being said, is there anyone here who would like to speak publicly? If so, you can raise your hand.
I have no one for public speak.
All right. Very good. Then we will move to agenda item number 2, approve meeting minutes from 4/8/2026. I did review them and I had no questions or concerns with the meeting minutes.
I as well did not have any. Everything looked okay to me. So I'll make a motion to approve the minutes from 4/8/26.
I'll second that motion. All in favor, Beth, yes?
Steve, yes.
All right. Next is the hearing on the proposed updates to tobacco regulations. So Ryan, do you want to give us a little quick intro?
Of course, yeah. So I'll just go over the 7 major proposed updates to our tobacco regulations. And then after that, if you'd like to open for public speak or public comment, anyone who chooses to comment on it is more than welcome. But for our updates to our tobacco regulations, the 7 proposals would be no permit renewal if there are 3 sales to a person under the age of 21 or under the nicotine-free generation age. Currently in our tobacco regulations, we already have no permit renewal, 3 sales in a year to a person under 21. This would just also include the nicotine-free generation age if we were to include that. Number 2 would be the inclusion of the nicotine-free generation age, which is just each year the age restriction for buying tobacco products in Easthampton would just bump up 1 year starting on January 1st. The third proposal would be doing a retiring cap for our tobacco permits. We currently have a hard cap of 19. We have 13 tobacco establishments. By doing a reducing cap, any tobacco establishment permit that is not renewed or returned to the health department would be permanently retired. Number 4 would just be updating our minimum prices for cigars, single cigars, as well as packs of 2 or more, just to be more in line with our neighboring communities. Number 5 would be limiting the sale of nicotine pouches to adult-only tobacco retailers. Number 6 would be just having set suspension periods. Currently, we already do 3 days for a first violation, 7 days for a second, and then 30 days for the third violation. This would just put in writing that a first violation on our tobacco regulations would be a mandatory 3-day suspension. And then number 7 is just updating how many feet tobacco establishments can be within a school or a existing tobacco retailer. It's currently 500 feet of a school, and it would just up it to 1,000 feet of a school or an existing tobacco retail establishment for any new tobacco or moving tobacco retail establishments that are already currently permitted. And that's it.
Question for you. Do we have a specific date that we've decided on for the nicotine-free generation? You said January 1st, is that?
It could be January 1st, and Commissioner O'Leary's here. She could speak to it as well. But I know Northampton started theirs on, I believe, July 1st, it might be. Meredith, am I correct on that? Yes. But I think January 1st would just be the easiest to enforce. And then the other recommendation I would have is if you were to adopt these regulations, I would ask that they don't go into effect for at least 3 months. So we're able to inform and educate all tobacco establishments. So there's no surprises.
Okay, sounds good. Steve, did you have any questions before we open it up to public comment?
Not at this time. I'm comfortable moving forward with the hearing.
Okay, if you are here to make any comments, please raise your hand regarding the tobacco regulation proposal.
All right, so we got quite a few. So I'll start. I'll say your name. Please just say your name and your address when you are chosen for comment. And then each person will have 3 minutes. At the 2-minute and 45-minute mark, I'll just let you know to please wrap up. And that is it. So let's start with Commissioner O'Leary.
Hi there. Good evening, board, and thank you, Ryan, for calling on me. I think just making sure you can all hear me okay. All right. Thank you for the opportunity to giving me a few minutes to speak. First off, I want to commend the board for taking on the important work of updating and strengthening your public health tobacco regulations as a whole and considering a range of evidence-based public health strategies, including nicotine-free generation. This type of thoughtful, forward-looking review is exactly what strong local public health leadership looks like. As Ryan mentioned, my name is Meredith O'Leary, and I forgot to let you know I am the Public Health Commissioner for the City of Northampton, and I reside in Southampton. So just, we just passed nicotine-free generation this last month in April, and it goes into effect, like Ryan said, on July 1st. So anyone born on or after July 1, 2001 won't be able to purchase tobacco or nicotine in the City of Northampton. At its core, nicotine-free generation is a public health strategy focused on one clear goal, and that's preventing addiction before it begins, not punishing people who already use nicotine. The policy regulates the sale of tobacco and nicotine products, not the personal use, and it's designed, to protect future generations without taking anything away from current adults. The public health rationale is straightforward. Most nicotine addiction begins before the age of 21 during a period of brain development when individuals are most vulnerable to dependence. If we prevent initiation during those years, we significantly reduce the likelihood of lifelong addiction and the chronic disease that follows. In that way, prevention is not only more effective, it's more humane than trying to treat addiction after it's established. Equity is also a key consideration. Over time, each generation has benefited from stronger protections than the one before, whether through bans on lead paint, asbestos, or other known health hazards. These decisions are grounded in principle that what we do pass on avoidable harm does affect our future generations. From an implementation standpoint, we heard a lot about this at our public forums and public hearing that we're hurting the small businesses, but the phased-in approach is actually giving retailers time to adapt gradually as the market changes over time. Communities that have already adapted this policy in Massachusetts have not experienced any widespread economic disruption, and public health goals and strong local business environments can both coexist. In Massachusetts, Northampton, I believe, became the 24th community to pass this nicotine-free generation. And I know about a half a dozen communities right now that are considering passing it itself.
15 seconds, Commissioner.
Okay, thank you so much. So again, this policy is not about restricting current adults. It's about ensuring that our future generations do not inherit a preventable addiction that they never chose. So thank you so much for your time.
Commissioner Riley, can I just ask you a quick question?
Yeah.
What was the rationale for starting your nicotine-free generation on July 1?
So sure, that is a great question because we grappled with that ourselves. When this started getting traction, the school of thought was to start on January 1st, but it's all across the board. We looked at all of the communities that have passed it, and there really is no rhyme or reason. We wanted to either stick with July 1st, which is our fiscal year and kind of keeps it clean, or January 1st. And we also wanted to give ample amount of time to our merchants.
Thank you.
Mm-hmm.
Next will be Heather Warner.
Hi, thank you for entertaining me tonight. My name is Heather Warner. I live at 115 Pine Street in Florence, and I work at the Collaborative for Educational Services as the Hampshire Franklin Tobacco-Free Community Partnership Coordinator. I have some longtime working roots in Easthampton. I was one of the founding members of the Easthampton Task Force and later helped apply for a over $1 million grant, which went to the school district for the Easthampton Healthy Youth Coalition. I also worked closely with the law enforcement in Easthampton to do compliance checks of alcohol establishments, and I worked with retailers who were extremely cooperative around what we call sticker shock and letting us come in and do surveys and surveillance in their establishments. So I'm here tonight to speak in favor of all of the proposed regulation changes, including restricting nicotine pouches to 21 plus tobacco stores, updating the cigar pricing, adopting the declining permit cap, and nicotine-free generation. One of the things we do at the Collaborative is we collect data on all of the 11 school districts in Hampshire County, including Easthampton. And from that data that is collected, we know that substance use among young people in Easthampton, is we see that vape use among 8th graders about 5%, about 13% for 10th graders, and about 25% for 12th graders, which is pretty high these days. We also see that in 12th grade, cigarette use is 9%, which has gone up after after vaping came around. And then we're also seeing 9% of 12th graders in the past 30 days using nicotine pouches, which is also a really big jump from previous years. In Easthampton, the adult smoking rates are actually higher than the state, with 17% in 2023 of adults smoking versus 11% statewide. And no surprise, Easthampton also has higher rates of than the state for heart attacks and high rates of asthma and hypertension. So I guess what I want to just say about nicotine, nicotine pouches are really an important issue for me. So I'm really glad that you're addressing that. They, just like Juul, they came in under the pretense that they were a cessation style product, but really, in fact, they're not approved by the FDA for cessation. And in fact, they tend to hook a new generation, just like Juul did, instead of being a step down, otherwise. And so it's those kind of emerging products like that, which are why nicotine-free generation is so important. Because even if we address one nicotine product, another one comes on the market and then another one. So thank you very much.
Thank you, Heather. Next, we will have Paul McNeil.
Thank you. My name is Paul McNeil. I serve as the prevention coordinator for the New England High Intensity Drug Trafficking Area, an Office of National Drug Control Policy program. I'm also an Easthampton resident and parent at 9 Taft Avenue. And I want to thank the board for taking these proposed regulations seriously and for continuing Easthampton's long history of leadership in youth health and prevention. These nicotine products, especially these oral pouches, these high potency nicotine devices, it's not accidental innovation. So these products are engineered to deliver nicotine faster, more discreetly, and in ways that are easier for young people to hide from their parents, teachers, and coaches. So we know something important, and that's the adolescent brain is uniquely vulnerable to nicotine addiction. Nicotine impacts attention, memory, mood regulation, learning, and impulse control during a very critical period of brain development. The earlier dependence starts, the harder it becomes to break. So prevention matters because addiction is far easier to prevent than to reverse. The proposed regulations are reasonable, they are evidence-informed, they're focused on reducing youth access, not punishing adults. Restricting nicotine pouches to adult-only tobacco stores recognizes that these products are especially appealing to youth because they are odorless, they're concealable, they're heavily marketed online and through social media culture. The nicotine-free generation approach is also thoughtful and gradual. I don't think it takes products away from current adult consumers. Instead, it prevents the tobacco and nicotine industry from continually recruiting the next generation of customers. And as a prevention professionals, we often talk about protective factors. So policy is one of the strongest protective factors a community can create. And when communities reduce youth access, reduce retailer density, limit predatory marketing, and keep high-risk products away from kids, youth use declines. So Easthampton has been a leader before on flavored tobacco and tobacco 21 policies. Tonight is another opportunity to lead with science, public health, and long-term community well-being in mind. So thanks for your time and for your commitment to protecting the next generation of young people in Easthampton.
Thank you, Paul. Next, we have Richard Lopez.
Thank you. My name is Richard Lopez. I'm a resident of Reading, Massachusetts, and chair of the Reading Board of Health. I'm also a retired primary care physician. And so I want to speak to you based on my experience both as a physician and taking care of patients with, experiencing the ravages of nicotine addiction, as well as a board chair who led the implementation of nicotine-free generation in Reading back in June of 2024. You should know that the policy is endorsed by the Mass Medical Society, the American Medical Association, and the American Thoracic Society. So as I was sorting this out, we went through public hearings, I got hundreds of emails. The way I thought about it was three things. First, there were things that people agreed upon. One is that tobacco and nicotine is unhealthy. And two, that, even the tobacco industry agrees, shouldn't be provided to people under 21, or at least they say. I want to emphasize, as was mentioned earlier, that adolescents are particularly sensitive to the effects of nicotine. There's a lot of evidence showing that it increases anxiety, depression, learning disorders, and can be a gateway to other substance use. So it's particularly important to prevent them accessing. The sort of second thing was, well, what are the uncertainties? One uncertainty was this is going to close the retail shops, the convenience stores. This has not happened in Reading in the past 2 years, hasn't happened in Brookline in the past 4 years, and there's been no outcry in the 20-odd cities and towns that have adopted it. So I think that this is really unfounded. One of the issues was, well, even though it has a very strong public health foundation, does this policy, nicotine-free generation, will it really work? We think it will, But what I would say is the current system is clearly not working. This limiting it to under 21 and calling it a day, as was mentioned by Heather earlier, is not preventing youth utilization of these drugs. And then finally, there's this whole issue of personal freedom and overreach of government. And the way I thought about it was, one, the Supreme Judicial Court ruled that this is a legitimate public health issue and legitimate for the Board of Health to implement this in
15 seconds left, Mr. Lopez.
in Brookline. I think the other issue is the right of personal choice. And, you know, when you look at the fact that so many people, adults who are addicted, can't quit, it's really not about personal choice when you're trapped with nicotine addiction. So I'll conclude by saying, you know, being a leader requires taking risks, dealing with uncertainty, facing opposition. But this is a good policy for us to move ahead with and free our society of nicotine and tobacco. And thank you for allowing me to speak.
Thank you, Mr. Lopez. Next, we have Maureen Busby.
Hi, thanks very much for allowing me to speak tonight. I'll be very quick. Other speakers covered most of what I was going to say. I work in tobacco prevention, and 6 communities that I work with were the first 6 boards of health in the world to pass this policy. All had an effective date of 1/1/25 and a birth date cutoff of 1/1/2004. It's gone seamlessly. The retailers caught on to it very quickly. They've actually told me that it's easier to check an ID now and just look at the year of birth and not be calculating a new age 21 every single day as they had to do before this policy. Also, the reason that we started looking at it was in my 15 years doing this work, I watched the progression or evolution of products from, you know, we worried 15 years ago about pink and purple foil wrapped little flavored cigars and did cigar minimum price to try to limit the access and sale of those. And then we had Juul, which somebody already mentioned. And since then, we've had many other products. We have soft, squishy pink teddy bears that are actually vapes, toy guitars, CDs that you can play music and vape at the same time, or play Mario Brothers on your vape. The industry is doing a great job of finding a way to get replacement customers. Smoking rates are going down, and smokers are literally dying off. So the industry, to keep making profits, needs new customers, and those new customers are our children. And they use the same playbook they used years ago in documents in the 1990s Master Settlement Agreement. That lawsuit showed that they said things like, hook them while they're young, and you have a customer for life. And that's the playbook that they're using today. And I go into these stores that I have to inspect, and I see the kinds of products that are attractive to kids, not to adults. So we know what they're doing and what they're trying to do. Also, I work with youth. I sent them into stores to do compliance checks. And while we're out driving around, sometimes they'll show me on their phones the social media stuff that they're getting that's popping up on their phones. I might get a hearing aid ad, but they're getting ads that are directed at 16-year-olds, 17-year-olds, 18-year-olds, and they show me what's on their phone. I'm not on the platforms that they are on. I don't see those. But between TikTok and other social media, these children are being assaulted by an industry that is looking for new customers. So I really appreciate that you're looking at all of the policies that you're looking at tonight, and hope that you will join the other 24 communities that have already passed NFG in Massachusetts. Thanks very much.
Thank you, Maureen. And one last call for anyone for public speak. That's everybody.
All right. Thank you, everyone, for coming and for your comments. We really appreciate all of the information that has been provided to us. So at this point, I guess, Steve, I don't know if you have any more clarifying questions. If you feel, I'll speak for myself. I feel like I have been adequately informed on this policy, proposed policy. And I've heard, feel like we've provided ample opportunity for the community to, give their thoughts on it. So I feel prepared and ready to vote on this. I want to make sure that you are in agreement, and if you want more time, I'm completely fine with that as well.
Thank you for asking for my input. I would like to maybe push a vote out for another month. I know we've heard from everyone, but the generation we're talking about, taking this away from. So, Ryan, I don't know if we could reach out to the high school, get one person that's willing to speak just for the record, and maybe someone from the We the People organization. I know they're involved in civics heavily there. And then next month, I'm comfortable to vote. Obviously, I know the impact that nicotine has, throughout my time in the hospitals and the rehab centers I've worked at. I think we do have a chance to impact, but, personally, I would just like to hear from the generation that's affected, even if it's from one person.
Okay, that's completely fair. I think also, so I agree. Let's have the vote on, have it on the agenda for next month, that we will be voting on it. I also wonder if we could nail down our start date, the cutoff age, make sure all of that is I personally, I feel like it makes sense January 1st of 2027. And then the age would be January 1st, 2020, 2000 and I can't do math.
Yeah,
2006. So that's sort of makes sense in my mind. And we can either have that be what we vote on next month, or we can discuss it next month, but those are my feelings.
So yeah, Ryan, maybe we just go right to the superintendent, tell him to put us in contact with someone at the high school. Maybe we'll get one person to give their point of view.
If all it takes for you to vote on is one person, I'll have one person here if I have to stand outside the high school myself. So we'll have someone here ready to go next month from the school.
And I'm okay with, if we do pass it, to implement it next year.
Well, it would just be where the age cutoff would start next year.
Yeah.
Ideally, we'd implement it within the next 3 months of when it gets passed.
Sure.
All right. So one way or another, we are voting on this topic next month. Sounds good. Thank you, everyone.
Thank you.
I think we can move on to the next agenda item. So this is another hearing on the variance denial appeal, Ginger Love Mobile Food Truck. I did review the paperwork that you had sent, Ryan, but if you want to just do a quick, brief explanation of what's going on.
Of course, yeah. So I'll just do a brief explanation, Sharila, and then feel free to explain after. But this is for a mobile food truck park that is going to be starting on Northampton Street next to Fire and Ice, where mobile food trucks would be there regularly for food service. And the request was for the mobile food trucks to be allowed to stay at the food truck park for up to 4 days before returning to their base of operation. However, in Easthampton, what we require in our mobile food truck applications, and the way that I interpret the intent of a mobile food truck as opposed to a regular food service establishment, is that mobile food trucks need to return to their base of operation at least daily to get food prep, food storage, proper cleaning of the truck and equipment, as well as any wastewater disposal and cleaning and potable water sources for their food truck and their food operation, as well as warewashing all the equipment. I don't believe it can be done on site in most food trucks. There are certain exceptions, and every food truck's a case-by-case basis. But for this variance specifically, it's Ginger Love requesting to operate in Easthampton for a maximum of 4 days without returning to their base of operation. We can't do an umbrella variance for all mobile food trucks that each have to do it individually. But this one is specifically related to Ginger Love operating for 4 days without returning to their base of operation. And then specifically on Ginger Love, a concern I have is that the past 3 food inspections, the past 3 pre-op inspections that we have done, which have been scheduled prior to opening every year, there were concerns where the truck needed a re-inspection. 2 of those inspections were cleanliness concerns, where the truck had to be thoroughly cleaned prior to being permitted to operate in Easthampton for the year. So just with those concerns and then my interpretation of the food code, I did not approve the variance for a mobile food truck to operate without returning to the base of operation daily, as that is what my interpretation of the intent of a mobile food truck is. Once you start getting into a mobile food truck being in operation for multiple days, it gets very gray between a mobile food truck and then a brick and mortar food establishment. Is there any questions? Anything I can further explain?
I have no questions.
The floor is yours, Sheila.
Good evening, everyone. My name is Sharila Diola. I own Ginger Love Cafe, a Filipino street food truck, and I'm the operator of Hawker Square, which Ryan, I was a little bit confused there because you're pointing at Ginger Love Cafe, which is very separate from what I was applying a variance for, which is the Hawker Square, which is gonna be the food truck park that's gonna be at 114 Northampton Street. So I don't know if we've had this confusion this whole time, but I'm gonna start with the Hawker Square.
Let me stop you real quick, just for time. So Hawker Square isn't permitted as a food establishment, so we can't do a variance for it. So it would have to be each mobile food truck that operates at Hawker Square would need to apply for their own individual permit, their own individual variance.
Right. No, I understand that. But Hawker Square is something that I'm establishing right now and putting together as a food truck park. So meaning there will be food trucks there will be people there. And what I've understood from Ryan is that he wanted us to drive in the daily in and out of the food truck park. My application, my request application is for it to be a 4-day rotation. So basically, I wanted to give you a little bit of the background on where we are. So earlier this year, Easthampton Planning Board granted us unanimous special permit after 2 public hearings to use this parking lot, the Cernak parking lot, as a food truck park. Fire Captain Constantine reviewed our site and confirmed that our fire access plan is appropriate. We have been moving through this process step by step, and we are grateful for the guidance. The 4 areas of the food code that Ryan was raising is how are we going to clean the vehicle and the equipment, disposal of liquid and solid waste, refilling potable water and ice, loading, storing, and transporting food if we're not going to go back to our kitchen every day. So I have submitted a proposal to Mr. Griffin that I would like to share with you via email, if I may. I don't know if you guys have all of the files, but I have a zip file for everybody that I can send that includes everything, all of the paperwork that I have worked out so far with Mr. Griffin. So for food transport, refrigeration is already built into every mobile unit. If a vendor needs to restock from their commissary kitchen, they do not need to move their truck. Per food code, food can be transported from a commissary to an event site in coolers with ice for cold holding and in Cambros or insulated hot boxes for hot food. That is standard practice at every event I have ever worked. For potable water, we have an on-site water spigot that's going to be activated Vendors also have their own onboard water tanks filled at their commissary kitchen. For wastewater, every truck has an onboard gray water holding tank. We also have a 320-gallon central holding tank on site and a licensed hauler contracted to collect and dispose of it properly. For equipment cleaning, vendors have 3 compartment sinks on board and sanitizing supplies. For deeper cleaning, equipment is transported to their permitted commissary kitchen every 4 days. For restrooms, we will have a permanent facility. We won't have a permanent facility, but we have a signed contract for Parker's Portables for ADA and standard portable restrooms to be placed on site. For base of operations, every vendor has their own permitted commissary kitchen, and they are required to return every 4 days. We have logs prepared for them to document every visit, and I will be the operator so I can implement this rule that they need to do this every single time. I also want to mention that multi-day food truck events are already happening across Massachusetts. Cities and towns have been approving this type of operations for years. I personally participate in many of them, such as the Brimfield Flea Market, the 3 County Fairgrounds, the Paradise City Arts, Franklin County, Green River Festival, Topsfield Fair, which is 10 days at the end of the season. And none of those was ever asked to move my truck off site. Each of those events has its own contracted compliant way of handling food safety. I also reach out to health agents in Brimfield, Chicopee, and Northampton because Mr. Griffin requested so they could speak directly what they do in their communities. So Douglas Mercurio from Brimfield said that they do have multi-day food truck events in Brimfield 3 times a year. Garrett LeDuc said that several permitted multi-day stationary mobile food establishment. His position is that if a food truck can demonstrate that all necessary operations can be done on the unit without compromising food safety, they allow it. Donna Bowman, the health agent in Northampton, shared that Northampton offers non-traditional temporary permits for farmers market and venues with longer consecutive seasons. She also mentioned that Northampton already has food trucks parked in private areas for multiple days all over the city right now. She also addressed some of Mr. Griffin's specific concerns, and I can share all of these emails with you guys so that you can review what the conversation is like between these 3 health agents and Mr. Griffin. And also the other thing is something that stayed with me after my last conversation with Mr. Griffin was when he mentioned that he felt I was lowering the food code standards. And that really made me stop and think of my way home because that wasn't my intention at all. As a food truck owner who goes to festivals throughout the season, I get inspected every single time. Health inspectors give us a checklist and we follow it. That is just how I always operated. So when I built the plan for Hawker Square, I was not trying to lower anything. I was simply taking what already happens at permitted multi-day festivals and applying it to a food truck park. But the more I thought about it, the more I understood where the concern was coming from. Hawker Square is something new. It does not fit neatly into any existing category. And because of that, the solutions we are proposing are also going to look a little different from a normal brick and mortar. We are not a brick and mortar restaurant, and we are not a one-day event. We are something in between, and our approach reflects that. So I want to, we're not asking to lower the food code. We are asking to meet it in a way that it fits who we are. Every standard is being addressed. It just looks unconventional because that is exactly what we are. It's an unconventional setup. Addressing the Ginger Love Cafe inspections, I believe that every single food truck that went through Easthampton Board of Health in the past have had records of reinspection. It's nothing new, we would always have to come back because there's something that we have to fix. At that time, when Ryan Griffin pointed out that it had to be cleaned, that was my bad. I shouldn't have brought the food truck from another site to be inspected by the Board of Health before I went to Paradise City Arts Festival. And I actually have emails back and forth because at that time, the health department have mentioned something about food spoilage and all that stuff in my food truck. And to me, I was really shocked because every food was frozen And I do have spices in the truck. And normally when they inspect the food truck, everything is emptied out. At that time, I had my food truck filled with stuff. So I am a Filipino food. There might be spices there that it's not pleasing to your nose or whatsoever. But what really kind of did it for me, meaning like offended me, was because they said that there is food that's spoiled there. Those words I believe that health agents shouldn't be using. It should be guiding us onto what health safety, safe serving of food. And I get it that you guys have to do your job, but saying those words kind of like it wasn't, to me, it wasn't proper. So I wrote everybody and had a complaint about that, because I felt like that's something that could ruin a small business, because food spoilage is not just through smell. It has to be through taste or touch or feel. It's just not one thing. And so I felt like at that time, when they said that there was food spoilage, when there wasn't, because I served that food at Paradise City Arts and nobody complained. I get invited there every single time. So these things that are Ginger Love Cafe stuff, I feel like the inspection is not part of Hawker Square. Hawker Square is a very separate business from Ginger Love Cafe. What I'm applying to today for 4-day variance, 4-day rotation proposal is for the Hawker Square. Ginger Love Cafe will have its own inspection with Ryan. And I truly believe that every single food truck has experienced that thing. I never violated anything. I never operated without a permit. I corrected all of the things that they asked me to correct. And my food truck hasn't really gotten anybody sick. So I just feel like, it's just the standard operating procedure that the Board of Health, when you get inspected, you always come back for something that they want from you. So just wanted to separate Ginger Love Cafe from Hawker Square, because I'm here for Hawker Square and that's what I'm applying for. Thank you.
All right, thank you for your comments. So there's no one else to speak, I'm assuming, correct?
If anyone would like to comment for public comment, they're more than welcome to. But we have no one currently who would like to comment.
Okay. Okay, so I think there's a couple of things here that I'm confused about. So first of all, and this is directed at Ryan. So the Hawkins Square, is that what it's Hawkins Square? Hawker, sorry. This is a park where where the request is to have multiple food trucks at this park. So the park itself would need to be permitted by the Board of Health. Is that what you're saying, Ryan?
Nope, that's not what I'm saying. It's Hawker Square is good to go, and they've already been approved by the planning board. They can have food trucks starting. The only thing where the Board of Health gets involved is per our mobile food truck application, we require all food trucks to leave daily back to their permitted kitchen.
Okay.
So it doesn't have anything to do with Hawker Square. Hawker Square has already been approved by the planning board. This is just for the request for mobile food trucks not to follow the Easthampton interpretation of the food code that would require them to return to their base of operation.
Okay. So how does that differ from the multi-day events that Sherla mentioned in terms of having food trucks for multiple days at the Brimfield, et cetera?
Yeah. So first of all, she really did an amazing job reaching out to a bunch of different communities and getting their input. A couple differences. Those events only happen a few times a year. I believe it was the one in Brimfield. That inspector goes there. It's a 10-day event. That inspector goes there every single day, is able to inspect the food trucks. The food trucks have connections to where water hookups, wastewater disposal. There's bathrooms on site. Speaking with the health director of West Springfield, at the Big E's, all of those areas, all of those food trucks that are there for multiple days have access to proper food storage, proper food preparation areas, as well as plumbing, wastewater, and it is protected by 24-hour security at all times. So as I explained to Sharila, if she wanted to implement something similar, if there was a permitted commercial kitchen that had proper food storage areas, proper food preparation areas at Hawker Square, that would be something that would be adequate for multi-day food trucks, similar to how we have Captain Jack's now, how they operate in the same spot, but they're operating at their base of location.
Okay, so if they were able to establish that they had those appropriate conditions, we could potentially approve it, but in the meantime, they would have to continue doing returning daily to their base of operations.
Yeah, and what they'd have to do is they'd have to get a full permitted commercial kitchen there,
Okay.
which would be plumbing, bathrooms, mop, sink.
Okay.
Each mobile food truck that's operating there would have to have their own food storage section.
Okay. I know Sharila has a hand raised. I just wanted to make sure I gave Steve an opportunity to ask any questions as well.
Ryan, what's the food truck on the Rotary at Ferry Street? Do you know the name of that one?
That was the hot dog one. That's gone.
Yeah. So last year it seemed like they never moved.
You got it.
Why they're gone now?
Yeah, I didn't permit them, Steve. But
Yeah. I just wasn't sure if you were with the history of it. I just noticed that specific one.
Yeah, no,
Always there, never moves.
they've been there for a long time. And to Sharila's point, they're now in Chicopee at the Home Depot, where it's my understanding that they're there full time as well. So, like I said, I've spoken to multiple municipalities. The mobile food truck code isn't quite up to par. It's a lot of interpretation. Some municipalities would be okay with it, and then there are others which seem to interpret the food code the same way I do, where these mobile food trucks have to, where the intent of a mobile food truck, what separates it from a brick and mortar food establishment is it's take everything in, take everything out. So all your food prep, all your food storage, it's on the truck. You bring the truck to an event, and then at the end of the event, you take the truck, your wastewater, the trash, everything, and you would leave. Where it starts getting a little where I was trying to explain to Sharila where my concern with the food code is, once you start having these trucks in a certain spot and you're bringing food to them, you're taking warewashing equipment, dirty dishes away, bringing clean stuff there. It's really where I think it is not up to the level of what the food code standard is for a mobile food truck.
Sure, I can definitely see the risk of someone. 4 days is a long time for food to sit around, especially if it's not kept safely. How is the site being powered when people aren't there?
It would all be electricity for the food truck. And correct me if I'm wrong, Sharila, but all the food trucks that have time temperature controlled food would be operating on electricity, right?
Yes, we have 400 watts of power right now. 800 watts of power right now, because the zoning board has approved us for 4 this year. And if we're going to do it next year, it'll be 6.
When is this space supposed to kick off?
Well, we're waiting so the issue is that the food trucks, so this is actually a pilot program. So it's a testing year. So when Ryan mentions that it has to have a full commissary kitchen, we're a seasonal business. We can't really afford that. Like the food trucks at the Food Massachusetts code is a contained mobile food vehicle. We have everything. We have 3 basing, we have preparation, we have refrigeration, we have grills, we have all these things that you need to cook food safely. And this is not something, and referring to the hot dog truck that was there, if Easthampton Food Code is really not approving any of the multi-day event, how is it in the past years, it had approved multi-day events? Maybe the code that Ryan is interpreting is something that, it's not approving the multi-day, but before prior events, the Board of Health with Brian Lesherplain and Bree, they allowed like the Mill Pond Live. We were there, we stayed there for like 3 straight days, 2 straight days. It was approved in the past. Why is it changed this year? And then nothing with the Innovative Act also that is on the food code. Basically, the food truck park is in a very unconventional setup, right? So the Innovative Act allows, the state allows every single health agent in the towns to approve businesses like this that doesn't conform in a brick and mortar scenario, so that anything that's creative businesses like this can exist, and with the 4-day, without the 4-day approval, it's going to be tough for us because gas is expensive. My commissary kitchen is 50 miles away, 25 miles away from here. That's 50 miles every day for us. The reason why we wanted this food truck park is that so that we can stay put for a few days and, not really put so much wear and tear on our equipment. And to me, in my experience as a food truck owner with other events that I have done all across the state, the food trucks have, the Board of Health have approved these types of operations. So I just don't understand why it wouldn't be approved in the Easthampton.
So that is why I asked for clarification from Ryan, and it sounds like the difference is that you're referring to isolated events that happen, a few times a year, as opposed to an ongoing seasonal continuous establishment. So I think that's the main difference. And correct me if I'm wrong, Ryan, but that's what my understanding is at this point.
You're 100% right. And like I said, we're not saying anything about Hawker Square. Hawker Square has nothing to do with us. That's more than fine to operate. But in regards to the mobile food,
Hawker Square can't operate without the 4-day though, because
I don't know. I guess that's the problem we're at though. So then it's more of how Easthampton views the mobile food trucks, and then it would go back to the mobile food trucks. And just a couple of real things real quick. That one, your operation doesn't qualify as an innovative operation because the food code already defines mobile food trucks as one of the permitted operations. But innovative operations have to be operations that aren't defined in the food code.
Right, exactly, because I'm talking about the food truck park. I'm not really here for the Ginger Love Cafe food truck. I'm talking about the food truck park, allowing the food trucks to stay in the food truck park for 4 days. That's my application, not Ginger Love Cafe is separate,
I think what Ryan is saying is, my understanding is that in order for a food truck park to, be allowed to function under our code, the food trucks themselves would have to go back to base daily, because that's what the food code regarding food trucks says.
The food code said regularly, not daily.
And the Easthampton's interpretation of regularly is daily.
So unless the food truck park has a commercial use kitchen on site, it would have to abide by the current East Hampton's interpretation of the food truck code.
Yeah, we're not going to be able to do that this year because the commercial kitchen, like we're small businesses, you know, we have commissary kitchens, individual commissary kitchens. And I feel like, can I request for you guys to go over all the variants, the applications, the feedback from other towns? And I guess my question is that, if the other towns are allowing it, I don't understand why Easthampton won't, you know, because they have, you know, if we have logs and if we're meeting every single question that you have, it's just in a very unconventional way. You know, there's nothing in the food code that says that we have to have a commissary kitchen right there, you know? So if we're gonna follow the food code, I feel like the whole interpretation of Easthampton is a little bit stricter than, you know, what the food code itself is expressing. And therefore, small businesses like us can't, you know, do business in the town of Easthampton in this capacity, which it could bring so much to the town, you know. And I just feel like if there's anything that, you know, we can do to kind of like meet halfway, so that we can operate that we're also not consuming so much fuel and wear and tear in our equipment going back and forth to our commissary kitchen. We would really appreciate that, so small businesses like us can do business, you know, and
All right.
sustain.
All right, thank you very much. I think we should, you know, probably wrap things up for this hearing. I've heard everything. I do understand where you're coming from. I understand Ryan's interpretation. I, at this point, am not inclined to grant an appeal to the variance denial based on the information that I have. Steve, do you have any thoughts or comments?
I'm on the same page as you. I think we should maybe look at the code again and give some stricter definitions for the future requests.
Yeah, I mean, I'm happy to review everything. I did review everything that was given to me in preparation for this meeting. I rely on our health director to you know, provide us with all the information, and his interpretation of the food code that is his job. And as a Board of Health member, I hear you know, everyone's comments, and I you know, try to make an educated decision assessment based on knowledgeable people. Like, I'm not a health inspector, but I rely on the people that are to give us that information. So certainly certainly would be all for a food truck park. It sounds amazing, but like, we have to stay within the confines of our health code. That's just how public health works. So you know, I can't.
Would you guys want to review the other health agents' knowledge as well?
Yeah, I will review everything that was given. If Ryan wants to send those emails to us, I'd be more than happy to go through them.
Yeah,
but at this point, I am ready if you want to, Steve, make a motion, but I am inclined not to approve this appeal of the variance denial.
Yeah, I'll make a motion to vote on the variance denial for Ginger Love Mobile Food Truck.
I'll second that motion. All in favor, Beth, yes.
Steve, yes.
Wait, hold on 1 second. Variance denial for my food truck or the Hawker Square?
No, we can't deny Hawker Square. It's just for your food truck to operate in Easthampton more than 4 days.
To operate
Yes, and any food truck at Hawker Square.
For more than 1 day. So your mobile food truck has to return back to the base of operation daily. You can't operate in Easthampton for multiple days. They'll return into your base of operation.
What about the other food trucks?
The other food trucks would be held to the same standard, the same code.
I guess what I don't understand is why are you not letting me operate for multiple days in?
We've already gone through it and we've heard your comments. We've voted as a board, so we're gonna move on to the next agenda item. But as I said, I will review whatever emails and information that you have sent to Ryan. I'm happy to review all of that. If it for some reason changes our feeling, we want to bring it up for discussion again, we can do that. But at this point, we've made our decision and we're going to move on to the next item on the agenda.
Okay, so I'll just ask questions regarding the Hawker Square. The Hawker Square.
You can actually, if you'd like, we can put it on the agenda
I
for
just
next
don't
month.
understand the judgment because it's combined with my food truck and the Hawker Square.
If you have further questions, I'm sure Ryan would be happy to continue discussing with you via whatever means of communication you choose. And if necessary, we can have this on the agenda again next month if there are further comments or questions. But at this point, I don't think further comment is going to change anything that's happening in the meeting. So it's my recommendation that we move on to the next agenda item.
Okay, well, thank you so much.
Thank you for your time.
Thank you
for
Sheila. I
coming.
appreciate it.
All right, so agenda item number 5, Director of Public Health update.
Thank you. So I'll be real quick. No major update. This month, the only thing is the Proposition 2.5. I strongly recommend that the residents of Easthampton vote yes. If the proposition doesn't pass, the Easthampton Department is looking at a roughly 40% budget reduction, as well as being unable to fill our staff vacancies and limits to our inspectional staff hours. So very crucial that we get the funding that we need to operate adequately in the city of Easthampton. Other than that, a couple of quick updates. Inspections are up to date. Camps are coming up. The farmers market we're getting applications and ready for that for the summer, as well as we have a temporary food event coming up for vegan Western Mass Food Fest in early June.
All right, thank you. Steve, you good to move on?
Yeah, we can move to the next agenda item.
All right, number 6, Health Inspector update.
All right, I'll also make it pretty quick. I'll just touch on a couple major things since the last meeting. Permitize, we're working on that kind of every day. Irza is working on the kinks. We're trying to shoot, I think I talked to Ryan a little bit today for June-ish. We kind of need to play around with it before it's live. I don't know if the complaint section is, Ryan. I don't know if you know. I don't know. You let me know.
Not yet. Still beta.
Okay. Still figuring some things out because we don't want to launch it completely until we have all the kinks figured out. Dynasty, there's new owners. There was a little they didn't realize that they needed a permit and do a plan review because they're keeping the same place. So we dealt with that. We went to their pre-op April 16th. They did not pass. And then they were back up and running for April 21st. So they're all good to go, new owners of Dynasty. I'll be going back probably in a couple weeks to check on things. Tong Sing, April 27th was an emergency shutdown. I went there for routine inspection. It was several violations, cleanliness, labeling, food contamination, food's not covered, thawing methods, all that stuff. So for the rest of the day, they were shut down. And then all the way to the 30th, I did another reinspection. So they're back up and running. But I'll be keeping close tabs on them. I'll probably also go towards the end of the month. There's a new establishment opening up on Union Street where Old Black Labyrinth was. It's a coffee shop. So I'm working on those plan reviews. Obviously, mobile food truck inspections. Short-term rentals, we're doing those actively, those inspections. And then, as Ryan said, camps. I'll probably start getting applications soon. For housing, Steve, I want to update you on 166 Holyoke. I know you're asking about that last meeting.
Yep.
So they went over there and they sent a correction order for I think significant debris and miscellaneous bulky items. And then Chris and Ryan went back on April 30th and they saw there was no change. They put a cease and desist letter on the door of the RV because they believed that someone was living there. They sent a new updated correction order for on May 5th. And then they have Tom from the Veteran Services working with that individual as well to get resources. He did pop in today looking for Ryan. So I think they'll have a discussion on what the status is. But he has been given resources to kind of help through that property. I think that was the one major housing. I'm still working on 531 East Street. I'm issuing them another invoice. They're putting all their stuff now in the backyard. So it looks like the front's clean, but it's all now to the street. So
No, I know. I actually had some coworkers today say, what the heck's going on with that street? Because they drive by it every day. So I appreciate the effort on that one.
Kelsey, what's the date for the ice cream place? Do we have a date for that yet?
The gelato shop.
Mm-hmm.
So yeah, that's Smudge Gelato. That's supposed to be in on Pleasant Street as well. I have no update from the owner. I have to check back in. I've been checking on like his Facebook and stuff to see if he's like, oh, I'm gonna open. It's like, no, you're not. I don't have a plan review from him or anything. So I'll probably give him a call tomorrow and kind of get a status update on where he's at. Because I have no floor plan, I have no spec sheets or anything. So I'll work on that tomorrow. But other than that, if anyone has any questions, that's it for me.
All right. Thank you so much, Kelsey.
You're welcome.
Good, Steve?
Yeah, we're good. Thank you.
All
Please
right.
keep it up.
All right. Number 7, community health worker updates.
All right, thank you very much. So, I do apologize. I didn't send you a report ahead of time for this meeting. Part of the reason for that is just that, nothing had really materially evolved since we last met at the forum. The 2 things that I can update you on, though, just to let you know, is so earlier today, Irza and I were over at the Council on Aging, and we had our pizza proxy party, and that was really just to do a presentation on how to fill out healthcare proxy forms and identify who appropriate healthcare agents would be, just for people within our community that if they become incapacitated from some sort of an accident or a medical procedure, to identify who the person would be to make those decisions on your behalf, and then not just to understand the treating the medical component, but also to to understand what the values and the beliefs and the sincerely held religious convictions are of individuals, to make sure that that also is carried through in their medical care. So we had, I think there was 23 people that signed up for this event. There wasn't a wait list, but I know the Council on Aging would prefer to have this be like a semi-annual event where the health department can go in, do some more trainings on healthcare proxies, or even things like living wills and testaments and that kind of information. So that's going to be ongoing. I'm going to, the next couple of days, just kind of look through what we did well for the training, what we could do better for the next event, and then just, kind of revamp stuff to make it better each time that we go. And then the other thing is, next on my agenda is to go through the Conservation Commission, specifically for the opioid Remembrance Garden. If you recall, probably this was maybe 2 months ago that I spoke to you about this, but Director Griffin and I have been working with Learn to Cope around planning for the annual candlelight vigil for survivors of addiction and overdose. And one of those proposals was to build a remembrance garden with opioid abatement funds. So everything is all set. It's cleared all of the final hurdles. The only thing that's left now is to put the proposal before the Conservation Commission to ensure that the sort of riparian area of where the pond ends and where the land ends, and just to make sure that whatever it is that we're doing doesn't create any negative impacts to the coastline to Lower Mill Pond. So I don't anticipate that there will be any roadblocks there because it's a minimally invasive proposal that's being put forward, and that native pollinator plants are also exempt from a lot of Conservation Commission oversight, just because it's the state's preference to have native pollinators planted. So that work will be ongoing here in the next couple of weeks. The other thing that I wanted to let you both know, and I have been letting the team at the health department know this, is that my time with the city of Easthampton was always going to be limited while I worked towards my hours for certification for a community health worker. That time limit is coming up in 10 weeks. So it's already a quick turnaround time. So with that, if you all had any thoughts or suggestions or things that I could do within the time that I have left, and you don't need to come up with this tonight, but please feel free to email me directly, or you could reach out to Director Griffin. If there's anything that I can do to support you as a board in these next 10 weeks, I'm more than happy to dedicate some time to, move some initiatives forward for you, or maybe do some policy analysis, whatever makes sense for the community, I'm happy to do. So with that, I'll pause if you have any questions. But otherwise, I don't have anything else for you tonight.
Okay, thank you, Brad. I did have one question. Did you invent a pizza proxy party? Because that's very clever.
No, I wish that I did. No, I know, and it rolls off the tongue very nice, and it's very easy to get people to look over governing and legal documents when you're offering
When
them
you're
pizza.
feeding them, yeah.
Yeah. No, but yeah, it's a really great event, and it's always nice to be able to partner with the Council on Aging as well. A lot of the folks there do a lot of similar outreach and work that I do in this position. So they've been really good community partners with the Department of Health. So
Great. Thank you. And I will think of things that we might be able to throw your way before you leave. I don't have anything off the top of my head, but.
Okay.
Yeah, me either. And, thank you for doing that. So often people are in the hospital, they don't have the right forms in line, and, Beth understands like I do. It's just creates unnecessary problems, delaying care, things like that. So thank you.
Yeah, of course.
All right. Last item is items not reasonably anticipated by the chair 48 hours in advance of the board meeting. I have nothing. Steve?
I'm good as well. So I'll make a motion to adjourn if you're okay.
Yeah.
Great. I'll make a motion to adjourn the Board of Health meeting on May 13th at 6:43 p.m.
I'll second that motion. All in favor, Beth, yes?
Steve, yes.
All right. Thank you, everybody.
And our local cable subscribers.